Welcome to the Habitual Excellence podcast. I'm Mark Graban from Value Capture, and we're joined today by Dr. Stephen Meuthing. Steve, how are you?
Very good, Mark. Thanks for having me today.
Well, sure thing. We're happy that you're going to share reflections and thoughts with us today. Can you start off by telling the listeners a little bit about what you do professionally and your background?
Sure. Well, hello, everybody. I'm Steve Meuthing. I'm a pediatrician. I call home base at Cincinnati Children's. I'm actually a Cincinnati boy from long ago. And my work is, I served as the safety officer at Cincinnati Children's, and now I lead all the quality and safety work. But over the last 10 to 12 years, I've helped start up a network of all the children's hospitals in the US and Canada. It's over 150 of us. And now, unlike the old days when we all pursued safety individually, hospital by hospital, the children's hospitals have changed dramatically and that we all work on this together. So I've got to play a leadership role in all of that.
Well, that's great. That sounds like very important and meaningful work. So that's an important mission, to say the least. And you're here today. I'm thankful you're going to share some reflections about Paul ONeill. So, like you said, you're a pediatrician. Paul ONeill was certainly not a pediatrician. So, how did you two even cross paths?
It is interesting. I have to say, I actually started my career for the first 13 years. I was just a country doctor in a small town, Indiana, 5,000 people. And just the concept of even ever getting to know the former U.S. Treasury Secretary never crossed my mind, much less came to reality. But Paul ended up being invited to Cincinnati Children's, and I think he took up the invitation because I think he passed on most, because he knew Cincinnati Children's was serious about our journey of safety. And I was a relatively new safety officer. And so I got to be in the room when he sat down with our senior execs and our board leadership. And of course, Paul came to listen. He's always a great listener. He's so respectful, but he always was there to push. And I just remember when he said to our senior leadership, after listening graciously for a while about all the work we were doing, he said something along the lines of, "I don't think you all are as serious about safety as you think you are." And I was just struck at that moment that I wanted to hang out with Paul ONeill. I never thought I'd get the opportunity, but I think a little bit of persistence and graciousness on Paul's part, he became a mentor and a coach. And when he saw the work and the vision that we had for all the children's hospitals working together, he gave me the time and an ear. And over the next 10 years, he really served as one of my coaches. And I have to say, I was very saddened by his death because he really was one of my heroes.
Yeah, he was a hero to many who had the opportunity to work with him. And I was wondering if you could talk a little bit more about the impact of the push. You said he was there to push. What were some of the directions, or can you talk about some of the ways? Where was he pushing you?
Yeah, I would say it was, again, it started with really putting it into action at Cincinnati Children's. And I would say it was on two levels. One was just understanding what he meant by making that deep commitment to safety, and how he really saw it as a deeper calling for anyone who was put in that position or accepted the position of leadership in healthcare, and that the idea that by leading an organization, we had to, on the flip side of that, accept personal responsibility that this is dangerous business and that patients can be hurt by it, and so can the healthcare workers. And that if we truly, truly felt that all of these people were our most valuable resources, and we fundamentally valued them as human beings, whether it was the patients, their families, or us, all of us as healthcare workers, then we truly had to dedicate ourselves to sending them home safe to their families every day. And then I would say really getting into some specifics that living it, the habitual excellence. And it got into the idea of that, is it really right of you to be a leader of a healthcare organization and not know somebody was significantly injured today? And what was their name? And how did it happen? And what are we going to learn from that? And then I also remember him pushing us on the whole idea of transparency, that what is it that you think you have the right to keep that information about harm or what we're learning about it private? What is it? And what's keeping you from sharing that with everybody? And so really pushing us to think of some things as that we used to think were just fundamentally the way to do business, private charts or private information to senior execs. No, that should be open to everybody. He pushed us to put harm information out there on our intranet so everybody at our organization could see it. And then that blossomed into sharing that with everybody across all the children's hospitals.
So that network of different organizations is sharing information about harms. That's what you mean. That's happening.
Yeah, it was, I think about 5 or 6 years ago, Paul was gracious enough and Value Capture helped with all of this. We actually invited all of the children's hospitals that were part of the network at that time to Pittsburgh. And we started it off a day before with, I think maybe about 10 of the CEOs actually spent a day at Value Capture with Paul ONeill. And he really pushed us. And basically from that day came the commitment that we were not only going to focus on patient safety as a network, we were going to focus on all of safety. And we changed our vision to from eliminating patient harm to eliminating all harm. And we've never looked back. We started sharing employee or workforce safety data at that time, and we continue to this day. And as best we can tell, we're the largest set of hospitals that share all of our workforce safety data with each other. And not just the data, but all the learnings. And we've set targets for reducing harm across the entire country. Well, it's really 2 countries. It's the United States and Canada. And just one little side story on that day when Paul, back in the days when we could all gather closely in a room, we didn't have to social distance from each other.
Right.
We were sitting around Paul's desk, and at one point he reached into his desk and pulled out an old sheet of paper. It looked like an old version of the Declaration of Independence or something. But what it was the notes from his talk that he gave when he first took over as the chair and CEO of Alcoa. And because we'd always heard the story about that, I'm going to make this the safest company in the world. And there it was on that original notes, just wrinkled up in his desk. So I know I got chills, and I know a number of the CEOs just like, well, if he could do it for that size organization, what's stopping me?
So he came across as, it sounds like, inspirational, where like a lot of people might be just threatened or turned off by that type of push. Like, what do you think it was about his approach that was appealing to you and made you want to work with him?
Yeah, I know all the stories. Some people run away from Paul, some people run toward Paul. I think there's something unique about the children's hospitals that as a community, we are a very values-driven type of organizations. And so I'm often asked, why is it that children's hospitals have let down their guard? To some degree, we're actually vicious competitors of each other. And what is it that has allowed us to come into the room together and actually share some of our toughest information with each other? And I think it's because we can see the higher calling of that. This isn't about making better margin or building bigger buildings or whatever it is. It's really about what's best for the kids and what's best for the healthcare workers. So I think Paul's values-driven message that this is about the calling of leadership to do the right thing. And it can be tough, and you have to be willing to take some risks. But when you're clear about what your true north is, it makes it easier. It makes it clearer on what the choices you need to make. And I think for whatever reason that tone resonates well with children's hospitals. Of course, as a pediatrician, I wonder why that doesn't ring true for everybody, but maybe we're a little bit different makeup.
Yeah. So I was wondering if you could elaborate a little bit. You mentioned a couple of minutes ago targets, and one thing Mr. ONeill talked a lot about was focusing, aiming for the theoretical limits of performance. Which one example of that would be zero harm. I was wondering if you could share some thoughts around that idea.
Yeah, I couldn't agree with Paul more, and I think I had that belief. Others had taught me well, and I had other great mentors, but he really pushed us to think bold and to think big. So really the vision of the solutions for patient safety, that Children's Hospital Network, is zero harm. And of course, we have no idea how to get there, but what's the alternative? And I can remember him talking this way, and I know I've come to talk the same way, and I'm sure I might turn some people off, but if you set goals other than zero when you're talking about safety, it leads you to have discussions about, well, which patients are you willing to harm today, or which staff members are you willing to send home damaged to their family or worse? So what it's come to be for us is that data is really the lifeblood. Otherwise, you're sharing stories with each other. You're almost just a culture club. And so we set specific targets every year. And so what now our CEOs talk to us about is that the future of working together is all based on getting results. And if you're not making progress, the question isn't, well, I guess, we tried and couldn't do it. No, the question is, what is it we need to do to get the results? And I have to say, for people who are driven by that never-ending desire to improve, it's so good to be surrounded by that type of climate. And I think that's something we inherited and take away from Paul. And it's so connected to the habitual excellence, because you got to live it every day.
Yeah. Yeah, and you made a comment there about aiming for theoretical limits and not knowing how you're going to get there. I think one thing I remember Mr. ONeill talking about was realizing, as the CEO, he didn't need to know exactly how Alcoa was going to get there, but the power in this approach is that you engage everybody in problem solving and continuous improvement and scientific thinking. It seems like there's a great opportunity for that as well in healthcare.
Yeah, in healthcare, it becomes a unifying structure in that for so long we've broken up into silos, whether it's research or innovation or caregivers or improvers or families or patients. When you start talking about, no, we're a group that's committed to eliminating harm across every children's hospital, then there's literally nobody who can't contribute to that. And if we don't know how to get rid of central line infections because all the standardization and all the process improvement has gotten us so far, well, then it's time for a breakthrough. And so that's when we need the innovators and the researchers. And we don't have 10 years to wait. We've been learning that with this recent crisis. When something needs to be solved, we all need to get together and solve it right now. And there's no reason why we shouldn't learn from this crisis and be taking the same approach on safety. We've shown we can do it. So we should be doing it. And I think one of the ways we can really honor Paul's call to do this work is as we move forward, I think there's real opportunities to build from this. And I think one of the opportunities, and there's actually a national action plan that's going to be coming out soon that's going to make this as one of its calls, is that we could learn from other industries, like particularly the civil aviation industry, and what they've done by bringing together a public-private partnership and relentlessly identifying problems and solving problems together. That's the only way civil aviation has made the tremendous progress they've made. And there is absolutely no reason why we can't do that in healthcare. And I know Paul believed that decades before the rest of us even understood it. But I think the time may be coming, and I hope it's very soon.
Yeah. So can you elaborate a little bit when you talk about lessons from the crisis? Is, it seems like the focus, whether it's on changing practices in hospitals, clinician. I have a physician friend who talks to me about just how rapidly the learning is taking place, rapid learning cycles and sharing within the medical community. And it seems like there's been this urgency and focus. I mean, is there more to it than that? Do you think that is one way of kind of summarizing, like, we need to have the same urgency about staff harm and patient harm, or is there more to it?
Oh, I'm sure there's more to it. We're talking about complex systems, so ever thinking that there's one answer to how to change complex systems is probably too simple of a way to think about it. But I think thinking about that is an effective catalyst for getting this going. But already you can see in the systems that have really made progress during this time, as opposed to just reactively pulled back into themselves. You see characteristics of leaders connecting with frontline on a regular basis, on a real rhythm, understanding the problems, respecting the frontline's ability to solve problems in the near term, and their motivation to solve problems, that deep respect for each other, that transparency of information, assuring information is flowing two ways, and then treating every day, every event as a learning opportunity, and that not wasting time on pointing fingers and assigning blame, except for people that really are way outside the normal expectations for leadership behavior. But assuming that complex systems are going to have problems, and our job as leaders is to help shine a light on those problems and then organize the people to solve those problems and then honor them when they do. I think I can see the systems that are doing that and breaking down what we thought were well-formed silos and forever standing foundations. And it's happening. Just as simple as all the work with telehealth, and that immediately within 2 months, we're learning that this is probably what a lot of patients and families wanted all along. And what were we waiting for? And so there's so many opportunities that are going to come out of this crisis. And I think Paul would expect nothing less of us than to jump on this and move forward.
Yeah. Yeah. So maybe, a final question. You've mentioned the phrase, it was an important phrase to Mr. ONeill, habitual excellence. I mean, that's why we've called the podcast series Habitual Excellence, to sort of honor that idea and his work. But do you have other thoughts on what that phrase means to you? It's easier said than done, perhaps, but what that means to work toward habitual excellence?
Well, at a very personal level, I watched Paul and tried to model myself as a leader in my day-to-day behaviors, in my actions after him. And so I think all of us as leaders should be constantly, at the same time we're trying to do our best, studying ourselves and thinking about how I'm spending my day, how I come across to others. And so, I remember the stories about when they built the new office, international office for Alcoa, and that Paul took a cubicle. When we rearranged our office, I made sure I took the smallest office. Didn't make a big deal out of it, but just, I think in the old days, I would have thought, darn it, how come I got screwed? When in reality, I sit in that office nowadays and I'm just so much happier. And I just feel like it's so much more living my values. And I think that's what Paul meant by habitual excellence. You got to live it every day and everything you do. And accept the fact that you're never there. You just got to keep improving yourself every day, just like you want the organization to improve. So I'm a long way from where I want to be, but I know I'm better for ever having got to hang out with Paul Paul ONeill, and I'll never forget him.
Well, thank you for sharing that story about the office and for sharing your reflections about your time with Mr. ONeill. Our guest today has been Dr. Stephen Meuthing from Cincinnati Children's Hospital. Steve, thank you. Thank you so much for taking time and sharing thoughts with us here on Habitual Excellence.
Thanks for the opportunity, Mark.